Hi guys, my name is Lilly Sabri. I'm a chartered physiotherapist and today I'm going to be talking to you about management after hip replacement surgery. Now it's really important before starting any of these exercises that you consult with your team, that may be your physiotherapist and your surgeon, to make sure that you're following their specific protocol. Everyone's protocol will be different dependent on the type of surgery you've had, your age, your gender and your general fitness levels. So the first exercises that we're going to be concentrating on are to increase blood supply in the ankles, the knees and the hips. It's totally normal after surgery for you to get a little bit of puffiness in the ankles where you haven't been moving your limbs as you normally would, and potentially even muscle wastage, which is where your muscles start to decrease in size and strength. So if you're still in a position where you're not moving very much out of bed, just simple ankle circles can really help with encouraging circulation throughout the body. You can also go with some ankle pumps. So the second exercise I recommend is to not only increase movement in the hip but also in the knee. All you need is a stretchy resistance band, and if you haven't got one of these, a towel is absolutely fine. You're going to pop that around the foot, and if you've got one, you're going to place a carrier bag underneath the heel. From there, you're going to encourage movement in the knee and the hip by sliding the heel up towards you. And for most of you are going to feel a little bit of tension here. It's really important that you're supported behind either by a wall or something nice and steady, or if not, your hand behind you. Just take it as far as you feel possible. If you feel pain kick in deep inside the hips, stop there. If it's just a stretching sensation, that's totally normal. Go as far as you feel comfortable, hold for 10 seconds, and then slowly ease it back out again, working the core as you do that. You're going to repeat that 10 times with a 10-second hold at the top, and you'll notice with each one you go just a little bit further. Don't be scared of pushing them boundaries a little bit. And back out again. So the next mobilising exercise we're going to be working for the hip is abduction, which is taking the leg away from the body, and then adduction to bring it back in again. So this can either be done in sitting as long as you're supported, or lying all the way down if you find it more comfortable. Again, I'd recommend, if this is very early post-surgery for you, to place a carrier bag underneath the foot to help you a little bit along the way. From there, you're going to slide yourself out as far as you feel you can go. Now, it's absolutely fine for you to use your hand a little bit to help. Again, pain deep in the hip, you need to stop. If it's just a pulling, absolutely fine. And you definitely don't want to be going any further than 45 degrees for normally the first 6 weeks, but please check with your surgeon what your specific protocol is. From there, you're going to slide back in again, and you're going to repeat that 10 times again. Each time it should go a little bit further, using that core to pull you back in again.